abnormal uterine bleeding is a problem that has to be assessed and treated. Normal menstruation refers to menstruation or menstrual bleeding 21 to 40 days apart, lasting no longer than 7 days. It's abnormal uterine bleeding when it occurs in between menstrual periods, after sexual intercourse, in menopause, and any bleeding that is irregular. The causes of abnormal uterine bleeding can be various. It could be a structural problem such as polyps, little benign or non-cancerous growth inside of the uterine cavity, fibroids, muscular tissue growth in the uterine wall. Ovarian cysts can also cause abnormal uterine bleeding. Sexually transmitted infections such as chlamydia can lead to abnormal irregular bleeding, as well as postcoital bleeding or bleeding after sexual intercourse. In menopause, the most common cause of bleeding would be vaginal atrophy or thinning of vaginal skin and bleeding from the vagina, but more dangerous is uterine bleeding from cancer of the uterus. Cervical cancer can also cause abnormal uterine bleeding. It's important to find out the cause of the bleeding, and based on the cause of abnormal uterine bleeding, we would prescribe the treatment to help the condition. To assess abnormal uterine bleeding, one would work out the history, how it started, how long it lasted, whether any treatments were used in the past, any triggers, any associated factors. For example, COVID vaccination can lead to menstrual irregularities in about 5 to 10% of women. Once we take in a very detailed history, I would perform clinical examination, take a pap smear, and also perform pelvic ultrasound, which will reveal all kinds of potential causes such as polyps, fibroids, cysts, and even indicators of cancers. We may have to perform certain blood tests for levels of iron to assess what kind of blood loss we are working with. We may need to do hormonal tests or check for other medical conditions such as liver disease or any type of blood coagulation disorders or bleeding disorders that can be precipitating to the bleeding. Once we have all the test results, we can decide on the treatment, and I will discuss a common treatments of abnormal uterine bleeding. The treatment will depend on the cause and the woman's age and her desire for future fertility. If we have a teenager with abnormal uterine bleeding, the treatment will most likely be hormonal, such as contraceptive pill or progesterone tablets. If we see a woman of reproductive age, we would also use non-hormonal and hormonal treatment. Non-hormonal treatment of abnormal uterine bleeding includes tablets that help to clot the blood, such as cyclopentone or tranexamic acid, in combination with Nurofen, which is anti-inflammatory medication. 2 of those medications together decrease abnormal uterine bleeding by 70%. We can add hormonal treatments such as progesterone tablets or contraceptive pill to control the bleeding. And in women who have completed the family, the treatment may include other procedures. For example, endometrial ablation. It's a procedure that destroys the lining of the uterus with a special device. It's performed in the operating room. It's a safe procedure. It's a day surgery. It's quick, and post-procedure recovery is very quick with minimal pain. 80% of women who have endometrial ablation do not have any periods in the future. This procedure is only suitable for women who do not desire to fall pregnant in the future and use a contraceptive, or for example they might have had tubal ligation or tied their tubes in the past. More advanced or more invasive procedures to treat abnormal uterine bleeding can be surgery. If conservative non-surgical options have not helped, then we may even talk about hysterectomy to treat abnormal uterine bleeding, but that's in the rare cases. Polyps and fibroids can be removed. One of the assessment tools of abnormal uterine bleeding is a hysteroscopy, or examining uterine cavity with a camera to look for fibroids and polyps and perform a sampling of the uterine cavity to exclude cancer.